Hello and welcome to the EHAD Physiotherapists Committee Meet the Author interview series. I'm Paula Loughnane, a physiotherapist and researcher in Dublin, and your host for this session. And our special guest author for the episode is Johan Blokzijl. So today we're going to discuss Johan's work around the development of clinical practice guidelines for primary care physiotherapy in people with bleeding disorders. So Johan, thank you very much for agreeing to be interviewed today. I know you're particularly busy. You're in the final stages of your PhD thesis. So the end is near, but you must be particularly busy. So thank you, first of all. Would you like to introduce yourself, please?
Yes, of course. Thanks for the invitation, first of all. Always happy to make time for the EAHED. I'm Johan Blokzijl. I'm a physiotherapist and PhD student working at the Van Creveld Clinic in the University Medical Center of Utrecht in the Netherlands, and doing some research on haemophilia and people with bleeding disorders, and mostly focusing on how we can support primary care physiotherapists, so local physiotherapists who are not common with the disease.
Great. Would you like to explain, I suppose, first, how the need for the guideline was identified? Because there was some work in the lead up to that, I believe.
Yes, of course. One of the researchers at our department started a questionnaire, a survey among physiotherapists working in primary care, physiotherapists working in the haemophilia treatment centers, and patients in the Netherlands. And we sent them around, and people filled in the survey. And then we found that a lot of people indicated that the physiotherapists themselves indicated that they lacked some knowledge on this disease. And also about 1/3 of the patients felt the same way when they were treated by a local physiotherapist, not an expert physiotherapist working in the treatment center, but someone outside. And then we further explored this, and we did an interview setting in which people primarily indicated that they wanted a clinical practice guideline to guide their everyday treatment. So have something to get back to when they're not sure what to do.
Very good.
So this led to the development of the idea to develop a practical guideline for this group.
And how did you actually go about developing the guidelines then? Because it was a real multifaceted approach. There were a lot of stakeholders involved.
There were a lot of stakeholders involved, and we started to read up on like the normal guideline development, but those are mostly based on a lot of literature available, and we anticipated for not having a lot of literature available in this field because it's a rare disease, and physiotherapy is also a small part in the research. So there's more research coming, but there's not a lot of research available. To anticipate for that, we involved 12 expert physiotherapists, all working in the haemophilia treatment center all across Europe. So we had a couple from the UK, from the Netherlands, Belgium, the Scandinavian countries, as we believed that they were similar to the situation in the Netherlands. And then we also involved some patients and primary care physiotherapists and some haemophilia treaters, like physicians. And the patient organization in the Netherlands, they all helped us developing these recommendations for the guideline. Okay. So a lot of people being involved in different stages. So, yeah.
Yeah, and it's interesting, like in that you had a large number of stakeholders, but they were, as you say, a mix of expert physiotherapists, but also there was a lot of patient involvement, which I think, and involvement from the primary care therapists as well, which is wonderful. How do these guidelines differ from those published by Mulder et al. In Canada? Because I know that they have developed clinical practice guidelines as well.
Yeah, these guidelines came about in the middle between the survey we did and the project we started. But then we thought we would still have added value of the guideline we were planning to develop, because we were specifically aimed at physiotherapists who are not expert in this field and don't see these kind of conditions often in their daily practice. So don't have the time to read about a lot of literature, so it has to be practical, it has to be applicable in their everyday work. And that's also why it was really helpful for them to also help us during the development of this guideline. Because sometimes the expert physiotherapist had an idea, but then the primary care physiotherapist clearly indicated it's not feasible or it's not possible in primary care. So it was really helpful to get all perspectives included in this document.
And how are you planning? Have you disseminated them yet, the guidelines within the Netherlands, or how do you plan to do that?
Yes, we definitely already started with disseminating the knowledge from this guideline, and we already hear back from primary care physiotherapists that are already using it. Sometimes they tell us not knowing that we developed them. So they said, I came across some interesting document, maybe you know it, and then I tell them, yeah, we developed it. So that's something sometimes funny, but we did it multifactorial. So we aimed some strategies at the primary care physiotherapist, so involving the association of physiotherapists. And then we also had some strategies aimed mostly at the patients. So the patient organization in the Netherlands, they put out some information on their website and in their newsletter, and give some attention to that. And then, of course, when we hear that patients of our clinic go to a primary care physiotherapist, we say, do you know of the existence of this document? And maybe it's helpful for your primary care physiotherapist. So that's different strategies, but yeah.
And do you plan to disseminate them outside of the Netherlands? Because it does sound like this work would be relevant in other countries as well. And definitely the group of expert physiotherapists that you involved, as you say, their healthcare systems are similar to the Netherlands. So are you planning to disseminate them outside of the Netherlands?
Yeah, we definitely think that it's relevant for different countries, and it would be a shame to only use it in the Netherlands. At the moment, there's only a Dutch version and an English version.
Yes.
But I know there are plans to at least translate it to French, and we're hoping to get it translated in different countries so people in those countries can apply it in their daily work more easily. So yeah, we're definitely planning to disseminate it in these countries. And of course, every local physiotherapist, it's not only translating, but it's also seeing if the situation in this country is indeed similar to the situation described in the Netherlands, and if all recommendations are also applicable in that country. Because you can imagine there are some subtle differences between countries and responsibilities of physiotherapists and the availability of physiotherapy in that country locally. So of course, yeah, it has to be both. But I think that the information is definitely useful for countries where there's good medical health care and there's clothing factor available or non-replacement therapies available. And of course, I think some recommendations are also applicable in countries with less availability of those, but then the situation would be completely different, and there needs to be, I think, a lot of change to the recommendations.
Yes, yeah. And are you planning further publications around the guidelines, or this was your first publication it was the second publication of the research group in relation to the guidelines. Are there any further publications planned?
No, there are not directly any further publications planned. Of course, the document is out there and people can use it. In the Netherlands, we did a comparison with the recommendations that are currently currently developed, and we compared them with what primary care physiotherapists therapists are currently doing.
Oh yes.
So that's something that we are currently working on, and I know there's a research project about the use of primary care physiotherapy across the whole of Europe. So that's projects that are still coming up, which have something to do with the guideline, but also have something to do with primary care in general.
Of course. And that sounds really interesting, that it's going to be taken that bit further, and that you're planning to see whether they're actually being implemented or not. And I think that's a very important aspect of the project. Bringing about guidelines, it takes so much work, And I think it's important to see that they're actually implemented after that amount of work.
Yeah, and I think it would be good to, in a couple of years, see if it is implemented, and maybe also see if it changes the practice of primary care physiotherapists, if they feel it useful, if they feel it beneficial, if they feel some information is missing. I think that's our next steps that need to be taken. But first, just implement this document and see if we can get more awareness about the existence of this document, and also people knowing that what it is and that it is available.
I think it's very exciting. The guidelines are they're very detailed, they're very comprehensive, and I think that they're a wonderful working document. I've seen them myself. I've read them myself, and yeah, they're a wonderful reference document. It's very easy to pick out the information that you need, depending on the need of your patient and the reason why they're presenting in front of you. So, fair play to you on the wonderful work that you've done. So, where's next for you? What are your plans going forward?
Well, then the next plans are finishing up my PhD, and unfortunately, I will be leaving hemophilia care. So I will be doing some research in another rare disease. But yeah, I'm sure that our research group is continuing the great work to improve the care for patients with hemophilia and other bleeding disorders, and to implement this document. And it's good to see that it's already being used, at least in the Netherlands, and hopefully in the coming years also in other countries. So yeah, really exciting.
Well, thank you for the huge contribution that you've made in the time that you've worked in with people with haemophilia. It's very much appreciated amongst us physiotherapists as well. So thank you very much.
Yeah, thank you for the interesting talk, and well, good to be able to discuss this information.